Next, we'll go to the second keynote lecture by Dr. Avinash sir on Alchemy of Excellence, transforming good into excellence.
So unfortunately, Rohit, the Ullu is not something which people like to be commented on, right? But still, there's so much of curiosity comes out of that Ullu. Can I have my slides, please? Right. It's on the other side? Okay. Okay. Now, we had a lot of discussions in the morning, and there's a lot of insights on how education has to be looked at, teaching has to be looked at. And in fact, my presentation is going to revolve around few things for which the solutions have already been found in the previous century by few educators. And my presentation is going to revolve around exemplary work of 3 educators of the previous century, and most of the work which they have published in 50s and 60s. And unfortunately, it has not found its way in medical education in a big way. Now, we all discussed much about interaction, the attention hooks is required. So I'm going to ask Pranesh, what would be your 3 learnings by looking at this slide? So as and when you keep focusing, right, and try to understand the 3 learning aspects, I would like to, this learning and retention pyramid was published by Edgar Dale and in 50s. So Pranesh, what do you think are the 3 learnings when you look at this pyramid?
That teaching others is the best form of learning.
Fantastic.
And doing more is much important than just having a passive absorption of the material.
Very good. There's one more.
Engaging in discussion like these conferences helps retain the knowledge better.
Right. Okay, I said 3, so okay. So there can be many more. For what the learning is you have to give very clear-cut instructions whenever you're engaging, because otherwise you get very diffuse, right? Now, there are 3 important aspects which you can understand in this slide. On the left-hand slide, you will see there are 3 learning styles anyone has. The auditory, then you have visual and the kinesthetic, one which will predominate over the others. And sometimes, and many times, people would have one and more learning styles. The reason why I'm telling you this is, if you have a content, let's say keratoconus or microbial keratitis, so you have presented this content in an auditory format, right? And if you again present the similar content in a visual format and kinesthetic format, the learning just gets enhanced. So when you present one content in many formats, and depending on the style and many other formats, the learning gets enhanced. That's one aspect of it. And the learning here is the style is important. And the second is the shift which we have to make from passive to active, right? So we talk about it, but we rarely do it. In fact, the irony is when we have sessions like this, when we do passive lectures, this is not the actual way it needs to be done. So it could be done in a way in which, in workshops, and in a way that it can bring about the behavioral change. And the third learning is, if you see, the retention gradually increases as and when we start teaching others. So is it important that we teach people how to teach? Is it important that we have learning sessions where we make them do certain things or involve in group discussions? But unfortunately, we involve them in lectures, and a lot of effort goes in lectures where the retention is just 5%, right? So these are the 3 important learnings from this slide. The learning styles of every individual is different. And second, the shift which we have to make from passive to active. And third is, by teaching others, the retention is maximum. So these are 3 learnings, and the 2 behavioral changes which we have to make is, we have to shift from passive to active, and second is make the learners understand how to teach. So those are the 2 behavioral changes which we have to make. So why am I harping on this again and again? Because this is going to be training of trainer sessions. In when you are delivering a content, it's not about the amount of material you want to showcase to the learner. It's about, you have a small content, you barricade your content, you talk about this content again and again, because repetition is a very good friend, and you have to talk on few things. Less is more, and repetition is a very good friend. So with that, I think we will move from Edgar Dale to Apurva. What do you think? I'm waking her up. So what do you think you're learning from this? So this is a work as and when you're absorbing this content, right? Give me 3 learnings from this slide, right? Benjamin Bloom has, when someone thinks, it's a dot in a dimension of time and space, right? So when we stretch this dot, this is what Benjamin Bloom did. It's a fantastic educational psychologist. He's published his work in 1960s, has undergone a lot of modifications, and there's a lot of information which can get out of this Bloom's taxonomy. So over to you, Apurva.
So this is Bloom's taxonomy, and this tells about the pyramid of order of the orders of levels of thinking. So the bottom of the pyramid is remembering or recalling. The second point which is standing out is that the application is the rate limiting step. And the third point is the highest order level of thinking is to create, that is production of new original work, stimulating ourselves to think, to author, to investigate.
Okay, fantastic. So I took you by surprise, but you did fantastically well. So how many of us have taken chewing gum from the mouth and stretched it as a kid, right? How many of you? Everyone has done it, right? And probably this guy did. He just took this dot in space and stretched it. And when he stretched it, the thought, he made it into a hierarchical format. And if we create a neural network and go in a stepwise format, so the thinking would get standardized. It may take some time for the neural network to develop, but it will go through all the process. So the information or the learning which we can have from this is, there are 2 orders of thinking: lower order level of thinking and higher order level of thinking. So unfortunately, medical education is predominantly on regurgitation. Give me 5 courses, give me 10 courses, and then you get a paper, you hang on the wall, and you call yourself whichever doctor you want. But if we have to make this shift and move towards an higher order level of thinking, that's what makes a different type of a doctor. Now, Bloom's taxonomy gives this understanding in both in subjective way and objective way to understand where the real problem is. Now, if you understand, there are 3 things in lower order level of thinking: remember, understand, and apply. So, and then you have higher order level of thinking, you have analyze, evaluate, and create. Now, in day-to-day aspect, how does it really translate? Let's understand in terms of diabetic retinopathy. If I ask Apurva what are the signs of diabetic retinopathy, she will rattle out hemorrhages, soft exudates, flame shape, blah, blah, blah. Now, if I have to ask her why it's round, why it's a flame, right? Why this hard exudate is where it is. So that comes to the understanding part of it. And if you're able to apply the information or the subtle signs, the language of science, and apply in that particular case, then you will be able to have, apply it to this perfection, because that is the major rate limiting step. Clinical reasoning happens there. And once you cross the lower order level of thinking, go to the higher order level of thinking, there are 2 other aspects which comes in. One is analyze and evaluate. Analyze is nothing in a simplistic way, is compare and contrast. Now, having made a diagnosis of macular edema in a patient with non-proliferative diabetic retinopathy, so we compare and contrast injections versus photocoagulation. That is analysis. And then evaluation is, you have to make a judgment call in trying to understand what works best for this macular edema in this particular patient, right? Injections or laser. And then you make a treatment protocol for that particular patient is right on the top. Or if treatment does not exist, then you be creative. There's a difference between create and creative. If treatment does not exist, you have an opportunity, and that's the reason why it is right at the top. Now, that's something which you can get from the Bloom's taxonomy. And it's objective in the sense you can tell your trainee or a learner that you have a difficulty in understanding, you have a difficulty in observation. You will be able to really pinpoint which level of cognition is the problem with the learner, so that they would be able to make those changes. So that's about what Benjamin Bloom did in terms of his cognitive taxonomy. So having spoken about what Edgar Dale did in terms of being transformative in moving from passive to active, and Bloom's taxonomy, the third educator which I'm going to talk about is Kirkpatrick. Now, if you hear most of the lectures, right, one thing which is common to all boring lectures is they put you to sleep, right? They put you to sleep. And with a good lecture, what do you think is, whoa, fantastic. The lecture is very good. But what's the learning out of it, right? What has been the learning out of it? And that's the reason why I'm asking every time, what has been your learning, right? What is the behavioral change you're going to make? So if your presentation or your teaching model itself incorporates by asking you the question that what is the learning which is being incorporated in your teaching session, and what is the behavioral change you want to bring it out, you have reached there at the level 3, right? And that's what he had published in way back in 60s. And if we understand this and incorporate as and when we are presenting, and we really won what we have to. And that can bring the results and impact. And with that, probably I'll come to the title of my presentation, The Alchemy of Excellence. And the reason why I put it at the end, because even you can have a lecture, 90% of them, no one knows what the title of the lecture is. So this is how the reality is. Thank you, Meenakshi, for giving an opportunity.